Good day everyone, I am Clarice Torres Lima and I am here in front of you to demonstrate on how to do a hand washing. But before that, let me tell you something on what is hand washing and the purposes of it. So hand washing is rubbing all together of all surfaces of your hand using a bar soap and water. And also hand washing is component of all types of isolation precaution to prevent any infectious agent, and this helps to reduce the number of microorganisms on the hand and less transmission of the clients and also the risk of cross-contamination among the client, and lastly to lower the transmission of the infectious organism to oneself. For the assessment, first is presence of factors increasing susceptibility and possibility and diagnose infection or HIV. Second is use to immunosuppressive medication. Third is the recent diagnostic procedure or treatment that penetrated the skin or body cavity. And fourth is current nutritional status. And fifth is signs and symptoms indicating the presence of infection like tenderness, pain, and swelling, and etc. So we should determine the related factors that could influence the environment. First is risk for infection. Second is effective health maintenance. So the skill for hand hygiene is identical of all types of health worker providers, including the unlicensed assistive personnel or UAP. And we have also nail polish. And now let's prepare our equipment so that we can save time and effort. First, we should have the bar soap. Second is the paper square. And the third is the cloth. And we have also nail polish. And now let's assist our hand. You should always remember that you should keep away yourself to this area so that you can avoid any bacteria. And now the nails should be kept short so that it can less harbor any microorganism and to prevent to scratch the client. And also you have to remove also your jewelry so that you can have the proper cleaning of your arms and the hands. And now let's start. We should adjust the flow of the water, just like this. So the water should flow from the least contaminated to the most contaminated area. So the hands are generally considered the more contaminated than the lower arms. So let's start. Just like this. You should have to do just like this. And now we have to put a bar soap. You should do like this. Use firm and rubbing and circular movement to wash the palm, back, and wrist of each hand. And be sure to include the heel of the hand. And interlace the thumbs and move the hands back and forth. On what I did, the circular action creates friction that helps remove microorganisms mechanically. Interlacing the fingers and thumb cleans the interdigital spaces. And you have the right palm over left dorsum with interlaced fingers and vice versa. Palm to palm with fingers interlace. And back of fingers to opposite palm with fingers interlock. Rotationally rubbing of all the left thumb claps in right palm and continue this motion about 30 seconds. Rub the fingertips against the palm of the opposite hand. Just like this. We have also to use nail polish to remove the dirt on our hands. You have also to do this. And now we have to rinse the hands. You should always remember that if you have a dry hands, you should pat it because you have it so that it can moist the skin. And now we are done. We have to dry the hands. Use the towel without scrubbing. And you have to discard it and put again so that it will dry. And now we are done, and we have to turn off the faucet using the paper square. And we have to discard it. And if you want a hand lotion so that your hand will be moist, you should have also to put it. And now we are done cleaning our hand, and now we are safe for any bacteria. Thank you.